So again, thank you so much for having me. I'm pleased to be here. I know I was with this group last year, Kari. I think sometime, same time, or maybe January or February, sometime this time when we did the protocol. And I'm glad that Carly will be able to share sort of how Bridgeport used this protocol as well. That would be great. I want to introduce from my team, Dr. Brianna Hennessy, who is on the call as well. Brianna was interning with us last year, but now she has completed her doctorate, and she's actually a research professor at UConn. So we're thrilled to have Brianna. She's actually working behind the scenes with all the attendance data on a monthly basis that districts report, and analyzing it and sort of talking with me and Dr. Dave Alexandra also on our team to sort of understand and just analyze and monitor the trends with these data. So I just want to make sure I acknowledge Brianna and Dave. I also want to give a shout out to Kendra Shakir and Dave Williamson on our team, because without them, we would not have the systems to get the data. And lastly, I want to give a huge shout out to all the districts and all your data people at the district level, because without them and them hounding you and your teachers who are tracking all this on a daily basis, I mean, if we all didn't do this together at such a scale and on such a regular basis, we would not have the kind of data that we have in Connecticut to be able to do this. And lastly, Kari and Steve, I mean, you guys are doing yeoman's work to keep everybody together and work through these really challenging years. So really, again, appreciate the opportunity to share. Really just a couple of points that I have. Just talk about some data trends, and then we'll get into the protocol. I mean, that's really what we have. And Kari, I know you have the protocol that I have sent this morning. Unfortunately, I didn't think, I thought I could just reply to the listserv, but it didn't let me. So it didn't go out by email in advance of the session as I had thought it did. So I have uploaded it in this chat more than once. It's the same version, but as new people join, I figured I'd just re-upload it just to make sure. So Kari, if you could just upload it one more time, so if people who didn't have it, that way they can get it. And then, so please do download the protocol. We'll just be working through it. It's really a hands-on session today. So we just want you to take time to look at your data. So let me start off by just saying, I think everybody knows this webpage where we're reporting these data. I don't think I need to repeat that point, but this is the link on there. And Kari, if you could just throw that in the chat as well, just so that people have the link if they don't have it. We've been doing this since last year, so it's the same data. And to get us started with the protocol, we're going to jump right into the protocol here. So if you could open up your version of the protocol, your document, and look at step 1, which is really, and I think everybody on this call should know this, but let's just take a moment to ground ourselves in the metrics. We have 2 metrics. We have the attendance rate, and then we have chronic absence. So I want to make sure that we're totally grounded in what those mean. So take a few minutes to look through step 1, which gives you the example, a simple example of, I think, 5 students, and shows you the difference between the attendance rate and chronic absence. So I'll do give a pause for a few minutes, let you read it, and then we'll debrief.
Ajit, there was a link you wanted me to share, and I don't see it. So is it the supporting student attendance link?
Yes, it's just that link. Yeah, there you go. Brianna put it in, so we're good.
Thank you, Brianna.
And I see the chat about the link to the resources. Those are also in the protocol as well. So as we work through the protocol, you'll see the direct links to it, to those Excels. Sorry, Zoom is, you can only do screen share, so it's not as user-friendly for me. Sorry to keep having different things show up on your screens. All right, let's and again, I don't see all the presenters, so I mean all the people on the call. So if you could do raise hand and just jump in to maybe to just share, how do you understand the difference between attendance rate and chronic absence? I don't see any raised hands. We need your participation.
The difference between daily attendance rate and chronic absence was the question, Ajit?
Yeah, yeah.
Okay.
Just would like to hear from some folks, like how do they understand those two measures?
We talked about average daily attendance a lot before.
Yeah, there we go. Christina, go ahead. Thank you.
Okay.
I'll take a stab at it. So let's see if I understand this correctly. So attendance rates is 1 out of 10 days that a child can miss. And then chronic is 3 of 5 days, which I lost my train of thought. Damn it.
All right.
Sorry. Jeez.
No, that's all right. That's all right.
Is it any student who misses 10% of membership days? So like say a student's been enrolled for 10 days in the school, but they missed 1, they're already chronically absent?
That is correct. That is chronic absence. So thank you, Erica, for jumping in. But how does that differ from attendance rate? Like, how do you see the attendance rate?
I think when we look at attendance rate, we're talking about like there were 93% of kids were in school today. But I think what we've all talked about is that that isn't a good way to measure anything because it doesn't capture the kids who are missing large amounts of school. So we don't tend to look at daily attendance rates at all anymore because it just isn't a good measure.
Yeah, I think that's it's one way to look at sort of a daily attendance rate. The challenge with chronic absence in the early months is when you just have 10 days or 20 days or even 50 days, 5 days makes a kid chronically absent, so or if it's the first month, 20 days, just 2 days makes a kid chronically absent. So you might it might sort of flag kids who might not necessarily have an attendance issue. The other thing is chronic absence ends up being what we call a binary measure. You're either chronically absent or you're not. And so it fails to capture students who might go from 96% attendance to 94% or 92%, or students who might go from 89% attendance all the way to 50% attendance. They're chronically absent, period, but you don't capture sort of students who are losing ground, if you will, on either side of that 10% cut mark. You see what I mean? I know, Rachel, I appreciate your jumping in there. So we do the attendance rate. Think of it like an average. An attendance rate is like an average. It just says, on average, what's the attendance of students? And on average, are they attending 85% of their school days? Are they attending 90% of their school days? Are they attending 95% of their school days? So think of it like an average. Chronic absence obviously gets you down to the, it's more of a student level determination. So in this example, you have these 5 students, 3 of them are chronically absent because they have missed 10% of their days. So it actually is helpful to look at both measures because when you're monitoring large trends or trends in schools, I think what we're seeing this year is actually there are schools that had really high attendance, like 97% averages with low chronic absence, who have gone from 97% to like 93% attendance. And so it's really what we're seeing this year is some of the higher students not with high needs are actually losing ground in terms of attendance. So it's helpful to look at both, but I just wanted us to be grounded in what the measures are because we report both measures. We don't just report chronic absence. Any other thoughts on the measures themselves? And I know, Brianna, you're on the call too. I don't know if you wanted to add anything else to that or any clarifications or explanation that you think might be helpful.
No, I love to hear that some districts find one more useful than the other. I mean, that's why we provide both. They do mean different things. You could have the same percent of chronically absent students as another district and have a higher attendance rate or lower attendance rate. So, you know, it's about what you're looking for in your district, and that's interesting to hear.
Great.
Jason Titlebaum has a question or a comment.
Oh yeah, hi Jason, go ahead.
Hi, G. So I do have just a comment about chronic absenteeism. And as you said, at the beginning of the year, chronic absenteeism is really a moving target. And we also see that closer to right around that October 1 cutoff for students that go to magnet schools, where they decide to come in or leave a magnet school or go enroll in a magnet school. Near the end of September, they only have about 5 days, 1 day absent. They're chronically absent for that month. And right around January, when families are moving into town, we get that again, where a student might only have 11 days. They've been absent twice. They're chronically absent until they hit that 20-day mark. But I guess one question that I have, last year, we were able to upload attendance for prior months. Is that something we are going to be able to do this year as well, to update data from September, October, November, or is that not an option this year?
We're talking about it. Kendra Shakir, as I mentioned, has raised that with me, and we are talking about it. If you remember last year, we used a lot of these data for those pandemic EBT cards, right? And we did multiple payouts last year. We did one based on up to January attendance, and then we did another one in May or June, I think it was. And then we had the corrections version, which actually I think is just going out now, or maybe going out soon or whatever. So but this year, it's not going to be that way. It's looking more like the pandemic EBT cards will come later in the year, just once. So I think it may be actually feasible for us to allow for corrections for districts that want to go back and correct it. But I want to just check in with Kendra, and she's out for a few days. She should be back next week, but we should be able to get back to all districts with that guidance.
Right, because I think that'll definitely have an impact on what is currently chronically absent.
Can you elaborate on that? Maybe why that might be the case?
Also, I think with the guidance of students who are quarantining at first, if districts were marking just students absent, like if they're quarantining at the end of a month, and the data is due the second Tuesday of the next month, they might just been marked absent. They never had a chance to go back and update the information. Somebody might not have told the office. The office might just not have updated the information in time for the data to be uploaded. So we met with our principals and we said our chronic absenteeism and our monthly attendance for schools where it was high chronic absenteeism but low monthly attendance. And then it was when we reviewed the list of students who are chronically absent, it was this student was quarantined for 10 days. They did all the work. They passed it all in. And we said this student should have been marked as, we call it absent quarantine, which marks them as present in our system. So they went back and did it, and monthly attendance increased, and students were dropped off of the chronically absent list. And that was across all of the different levels. So students with high needs, students with disabilities, students with free reduced meals. So it impacted our numbers substantially, where we had higher attendance monthly and lower chronic absenteeism.
And we don't have that data, right?
Right. It wasn't.
Okay.
It hasn't been uploaded
Corrected.
yet because it was back in October, but it wasn't updated until November or late November, so we couldn't go back and update the October data, things like that. And especially come January, where a lot of districts had a lot of students that were out. They might have just been marked as absent at one point, but they should have been marked the other way. We just uploaded the January information. We're still getting updates going through.
No, I think that's super helpful feedback, actually, Jason. So we've been talking extensively internally as to why we're seeing the trends we're seeing at the state level. And I know you'll get a chance to get into your data too, but this may be good for us to chat at a large group level. You know, I've put up the attendance rates for last year. I mean, for the last 3 years, right? And Brianna computes these every month. It's a massive operation here. I mean, you notice 1920, 2021 and 21-22, we're down in 21-22 in terms of our attendance rates. Like we have lower attendance. But if you look at the next two buckets, students with high needs and students without high needs, you know, you see that the decline is greater for students without high needs. And that kind of has been the pattern really from the very early on. And it's been like, whoa, what's going on here? You notice English learners attendance is kind of similar overall, slight decrease in students with disabilities, slight decrease in free meal eligible. Students experiencing homelessness, actually slight increase compared to what we saw last year. Now, again, notice this is all in the 80s, right? You may not see this in chronic absence rates because these are all well below the chronic absence threshold. But when you look at attendance rate, you see that slight increase. So clearly the decrease was here, and that this kind of jives with what Jason's saying. If there are students who were in person and they were quarantining, which is a COVID-related reason, and they were receiving remote learning, which was, they could have been marked present, but you know, the timing of the data submissions, whatever, they ended up being marked absent, but they were they would have been in person and marked absent, but they really should be remote and marked present. You see what I mean? So your in-person attendance rate would have been lower, and then attendance overall ends up being lower. So we think that some of that's going on this year. And if I might go to the next slide here, this chart actually talks about how many of the days, this is total days, this is not kids, this is days, you know, every kid up until January, let's say, could have attended, I don't know, Brianna, what our average, our total number of days. I know data people hate being put on the spot, so I won't do that. But you know, maybe in the 5 months, September, October, November, December, January, maybe we've had about 90 days, 80 to 90 days, something like that, you know, with holidays and whatever. This just means that, and every student has had 80 to 90 days, right? So if you take the 500,000 students, in each of them roughly about 90 days, and you see how many of those days, student days, are in person, for all student groups, vast majority of the days are in person. 98% of the days are in person compared to what was last year. Look at that, about 30 to 40 to maybe 50 for certain groups in person. Vast majority of our days are in person, but there's a chunk of kids, almost 30% of our students who have experienced at least one remote day. And that's what we're seeing. The next thing is attendance on in-person versus remote days. You know, how was attendance last year? I'm sorry, this is just 2022, but we've sort of compared this to prior year. You notice that attendance on in-person days generally is better than attendance on remote days. And this was the same pattern we saw last year. But what we're seeing this year is that on those remote days, attendance is actually a lot worse on those remote days than attendance was, you know, compared to remote day attendance last year. So last year, maybe this, instead of 79.7, was maybe in the 80s, like mid 80s, you know, and that it's a lot lower this year. So I'll pause here for a minute, and I'd like some reactions. And Jason, you might have been hinting at this. What is the nature of that remote instruction this year compared to last year for the kids who are, you know, remote due to a COVID reason? Not because they want it to be remote, right? There's no choice this year, we know that. But if they were a COVID-related reason and they were remote, what is the nature of that remote instruction? And how do you think that might be playing into the fact that on those remote days, attendance is actually a lot lower? And anybody, please feel free to raise your hand and jump in. And Jason, I know you want to get in, so please go ahead.
Just anecdotally from staff that's here, but also from the teachers, some issues are with students now getting COVID and having symptoms. Some of them are home quarantining and they're just not well enough to attend those remote days. So they are in fact being marked as absent, and because they're quarantining, they're now being marked as absent, remote, or however other districts are doing it. So that has an impact on the remote days, because the kid isn't a student's not in person, they're quarantining, therefore they're remote, they're not doing the work, therefore they're absent. For our younger grades, it's more packet type work. So we're trying to do, they get a packet to do, they submit it in, they get the work done. They're marked as present. For the older students, the high school level, it's more of a drop-in. The teacher might set up the camera and just do the lesson, and the student drops in on their own. So it varies between grade levels, and I think students now showing symptoms and being sick, I think that's having an impact on their attendance remotely.
That's helpful. Other thoughts? Are others seeing something similar? Meaning that on the remote days, kids really are sick, aren't able to do the work. Anybody else want to chime in? Nancy, go ahead, please. If you are speaking, you're muted.
Sorry
There we
about
go.
that. Yeah, last year we had about 50% of our students that opted for remote. So they were more likely to be at home and healthy and able to participate. Whereas this year, if they are remote, just like he said, many of them are sick. So I think there's a reason that they're not participating. Also, I wanted to just comment on the non-special needs group.
Non-high needs, yep.
Yeah, high needs. I think that here, you know, we have told people that if your child has any symptoms whatsoever, keep them home. And sometimes in the high needs group, those parents don't have the option because they can't miss work. They can't stay home with their child. So I think that may be impacting that, you know, so the economic circumstances of the families sometimes dictate whether they send the child or not. Most of them are trying to keep them home, and that's why our absentee rates overall are terrible. And the chronic absenteeism is way up there. And I don't know what we do about that, because we're sending one message to say, stay home. And then we're sending this other message saying, hey, we don't want you to be chronically absent, so come to school.
Thank you, Nancy. Appreciate that. All good, really good insights here. Yes, Jean or? Jeannie, I'm sorry. Go ahead, Jeannie.
One thing that we saw here in New Haven was that, and we've been correcting it little by little, thank God, that our families weren't aware that they have to call and get triaged with a school nurse to get that okay that the child can stay home because of COVID symptoms or isolation or whatever is that what was the case, and then they can get the credit for the day after completing the school packet or whatever. So the parents, what they were doing, they were just keeping the kids anyway without letting informing the schools. So that was a problem. So when we got a hold of that the parents were just staying with the kids because they had symptoms, but not letting the school know and not letting them triage, we had to let the schools know, no, we have to let the parents know that they have to call the school, get triaged, and then we can get that all rectified, so that then we can go back and fix some of those problems. Well, but that was a problem, but was fixed little by little.
So yeah, if the parent doesn't inform you, then you don't even know that they're doing it, and then you can't help them with it, get them the packet or whatever, so that they can get credit. So yeah, I mean, it is a vicious cycle. You know, I'm seeing the chat too, which is helpful here. Christina, your point about could it be that districts are not honoring remote days? It's possible that some districts just aren't keeping up with it, but I don't know that for sure. And I think that, and Galligan, I'm not sure who that was, but I think that's a really good point too. Last year, it was a live streamed class, but this year it might just be a packet or just, hey, it's up to you to put it in Google Classroom, and there's much less oversight and much less active management of the remote program this year. We totally agree with that too. And I know there is an access to technology may have changed. It's possible. Just know that all your schools, have access to hotspots as well. And frankly, you remember the hotspots from last year, right? We renewed those hotspots this year. So if there are connectivity issues, there shouldn't be connectivity issues or challenges, except in very rare cases, maybe. But districts have hotspots, and we've renewed those hotspots. And what the usage data is telling us is that they're not being used as hardly as much less than what they were used last year. So, I mean, students aren't remote to the extent they were last year. That's just a fact. But there are kids who are remote, and so it's just how do you support that? Non-quarantine but having symptoms. Yeah, Mike Galligan. Okay, thank you, Mike. Appreciate it. Yeah, I think Hetty, your point about parent challenges, and I think that's what I think Jeannie may have been talking about, or maybe somebody else mentioned that too, that in families not being able to support their kids with whatever remote work needs to be completed because they're back at work, so to speak, and not able to help their child as much as they might have been. Yeah, all good thoughts. Excellent. These are kind of what we've been hypothesizing, but it's really good to have sort of your confirmation. And of course, you've seen the chronic absence rates, and this is as of January. Chronic absence rates are obviously higher. And if you look at this bucket, and this is the students without high needs group that I was talking about, it's almost twice what it was last year. And Jeannie, did you have another point? Oh, it's an old hand. Okay. No worries. And I wanted to raise one other chart. And I don't believe we post this chart on the website or have a report that you see with your data, but I wanted to share this particular thing. And I'm going to give a moment for you to just look at it here. And what this is showing is, what is the attendance rate for students who were chronically absent last year or who were not chronically absent last year, based on what learning model they attended last year. Okay, so let's look at the first group. There were a bunch of students who were fully in person last year, a small percentage, who came every day to school last year. If those kids, among those who were chronically absent, their attendance rate this year is substantially lower, almost 10 points lower, right? So if they were chronically absent last year, even if they were in person, their attendance rate this year is lower, substantially lower. So last year's chronic absence is predicting this year's lower attendance, okay? And that's consistent across all learning models. So meaning that if kids were remote last year and they were chronically absent, their attendance rate this year is substantially low as well. So meaning that the kids who had poor attendance last year also have poor attendance this year. Those who were remote last year have lower attendance this year, even if they're in person, right? Those who were remote last year, excuse me, but were not chronically absent, they have slightly lower attendance, but it's still over 90% on average. So that's good. But if they were chronically absent last year, they have lower attendance this year. And that's just true across the board. Substantially so for those who were remote last year. So if they were remote last year and they were chronically absent last year, that's the group that's really struggling this year. So it's just an ongoing, it's just a perpetuating cycle, meaning that we're all struggling to re-engage the students who were chronically absent last year. They're the ones that continue to have attendance issues this year. So presumably you should have seen that. You should be seeing the kids who are struggling with attendance this year probably struggled with attendance last year too. Mental health, yeah, I see Mike's point about mental health. Yeah, Jason, your point about not providing Chromebooks is interesting, meaning that you don't let them take the Chromebooks home this year, while last year you might have let them take it home, or they just don't have Chromebooks.
So last year, any student that needed a device for remote learning, we provided them with a device. We had the mobile hotspot so that students could get online. This year, the schools made the decision for the younger grades that the Chromebooks were going to try and stay in the buildings, because we also ran into the issues of damage and constantly needing to replace devices and repair devices. So that's why the younger students are getting packets, because what we also found is for the kindergarten, first and second, third and fourth graders, it's harder for them to get onto the Chromebook, to enter in their username, enter in their password. It's something that really the parents had to help them do and make sure that the camera was on. They knew what they were doing to get the work done, whereas you can give them a packet and the student can really do the packet on their own. So this year, some schools made the decision we're not going to send the devices home. Our two high schools, they're already one-to-one, so the students already have their own laptops that they bring back and forth for classes. So they already have the devices. So if they did have to quarantine, they have their laptop. They can do that drop in office or classes, if you will, to get to class for those days.
Interesting. Yeah, I mean, perhaps, I mean, I don't know. Again, this to me, you're just speaking to the less robust nature of the remote learning experience for the students this year. Just because I don't think that has been part of the plan, really. And I think for the right reasons, in that we want students to be in school and learning, but I think those remote days are suffering more so this year than last year for some of these reasons. No, I think mental health was also mentioned here. Yeah. Yes. I think the symptomatic students being home is key. And I know there are a couple of questions on the Remote Learning Commission and so on. I'll try to address them at the end of the session, because I think that takes me off a little bit on a tangent here from the attendance discussion. But I will address that at the end. So I think let's get into the protocol here. So you all have the Word document. And I'm going to stop. I think my PowerPoint piece is done. So I'm going to stop sharing the PowerPoint, and I'll put up the protocol itself on the screen. If I can figure out a way to do that. Oops. Well, where is that protocol? There it is. Okay. There we go. Okay, so we looked at attendance rates and chronic absence. So let's look at the first activity here. There is the link to the Excel, and let's do this top part here. Open up that Excel. You can filter for your district and review the data. The question is basically, what is your attendance rate for your district in 21-22, and how does that compare to the 2 prior years? And Stevens posted the protocol again, thank you. And which subgroups of students reflect lower attendance in 21-22? Let's start with the first part here. So take a few minutes to do that, and I'm also going to open the Excel myself. And whenever you're ready to, with some thoughts, observations, please raise your hand and you could start chatting here. And if you want to get ahead, you can do this part too, which is to look at the school level Excel. And feel free to look at that as well. Who wants to jump in here? Come on, folks. We need your participation.
There's a lot of information to filter through there.
Yeah. Next time we're doing these in person, right? So that we can actually engage with each other much more easily than in a virtual environment.
Hey, Ajit, just a quick
Yeah, Hetty, go ahead. Oh, nice
something
to see
to
you.
notice. I see some districts, the patterns are actually different. There are
Mhm.
some districts that are decreasing and some districts that are actually increasing from last year. And it'd be really interesting to know what's going on in those bright spots.
Yeah, yeah. And when we looked at the data, we see more decreases, greater decreases in students with lower poverty, lower high needs students. Sort of trending with the state data, you know, that the decreases are actually not just with our vulnerable student populations, but for some of the reasons cited here. And Kara, I see you have your hand up. Please jump in. Nice to see you.
Sure. Yeah, nice to see you. You know, we've seen a steady decrease in the attendance rate, not, you know, a couple percentage points. I think being fully remote for most of the year last year, really to people's points earlier around like the synchronous instruction that was done remotely really helped our attendance rate during that challenging time. Because people were able to be engaged, parents were more likely home with their students. This year, as a lot of people have said in the chat, you know, where our current rate is more about 91.4, whereas in 1920 we were at about almost 95. The keeping kids home with symptoms without verified COVID cases and things like that, where they're not necessarily quarantining with remote access to schooling, that's our biggest piece of like kids being sent home constantly, and they're not engaged remotely with our classrooms, because they were just like sent home. So this is, you know, this was a huge issue in most of our schools, particularly elementary schools where nurses are seeing the students throughout the day. So many students at home.
And is that a new development because of the change in guidance around no more contact tracing, and that it's really just symptom based? So it's really after January. Is that fair to say, or was it happening?
No, I think
to some
it's been
extent
an issue
before?
all year. I think we saw it exacerbated, but certainly it's been an issue throughout the year. And certainly, you know, to people understanding that people's anxiety was very high starting this year of any sign that a student was sick, they were sent home.
I just highlighted Danbury. Hope you don't mind. I was just trying
That's
fine. Anybody else want to jump in and share what they're seeing with their own district and school data here? This is a safe space. Everybody is here to problem solve on attendance. So.
Ajit, this is Jay. Could I ask a quick question?
No.
Okay.
Just kidding. Just kidding. Yes, you can.
If a district isn't represented on this chart, is it because their N values are too low?
All districts should be here.
Okay.
I'm not sure who you're thinking of.
Maybe
but-
maybe I looked at an earlier chart and not enough at this morning's chart. So I'll go back
Okay.
and check. Sorry.
Okay, no
Right.
worries. Anybody else have a thought here on their own district's data and what they're seeing?
This is Tony Loomis from Wallingford Public Schools. It looks like we were pretty consistent between 2020 and 2021. We were at 0.954 and then 0.955, so no real change there. But then for the current year, we're at 0.92, so a big drop off for Wallingford.
And what's your experience, Tony, in terms of why that might be the case that you're seeing? And is it particular to any schools that you're seeing?
I'm at the district level. I'm not sure. I'm not sure yet. We haven't, our attendance committee hasn't dove into analyzing the different schools.
Okay. I think that this is the school level spreadsheet. This is the second link in that protocol. And Tony, if you don't mind, I'll pull up Wallingford since we're talking about it.
Please.
So here are the school level data. Again, not subgroup data, just all students. And you can look to see where the declines might be greater, perhaps. You know, I mean, you know the schools here, but seems like it's across the board. Maybe a little more so there, or maybe there at the high schools, perhaps.
Those first two that you highlighted, Moses Y. Beach and Lyman Hall High School, they serve students that are typically from a lower socioeconomic part of town. So I wouldn't be surprised if, I guarantee that's part of it. There's some sort of connection there.
Yeah, I do see even for Dog Hammer School, you know, you see the 95, 95, and then 91. So I think it might be playing a part in a lot of the schools too, but in other schools as well. Sally, I see Sally's comment in the chat. Sally, I don't know if you want to give voice to that comment. At the secondary level, we have a group of students, not SPED-RL, who are not engaged in school. This is new for many reasons. Maybe if you would like to give voice to that point, as to why that might be.
Yeah, we're seeing an increase in poor attendance, lower grades, students disengaged. And they really have come to the top because we don't have robust SRBI resources and haven't really programmed in the past. This is a kind of a new group of students that we see great need with. They're not special ed, they're not L. We haven't dug, I think many of them will be low socioeconomic, but we don't segregate our data that way. So it's definitely a new group that we're struggling with of how to meet their needs.
Is this, you said, only in high school or really across the board?
Definitely middle school and high school, maybe upper elementary. I do think some of it is mental health as a result of remote learning and the pandemic. But how do we help support these students and families? And I think our families are exhausted also of those students.
Just to chime in, Sally, I think mental health is a major part of that. In Wallingford, we're one of the schools piloting the DESA Universal Mental Health Screener to all kids K-12, and almost 40% of our high school students total, so not even thinking about special ed or EL, almost 40% were flagged as in need of instruction, in need of help, mental health assistance. And so that was hugely increased compared to our elementary levels, our lower levels. So I think mental health is definitely a big part of that.
Yeah, and I think that traditionally those grades are less equipped to help address those needs, right, historically in our schools.
G, I just wanted to chime in on something that Tony just mentioned, because I think it's important kind of for this conversation when we think of root cause of attendance concerns, to be able to layer other data sources you have on top of your attendance data. So Tony, you mentioned the DESA. It'd be interesting to look at your DESA data and students in need of instruction along with your attendance data, to see if there's any correlation. The other just thing I want to put out there is that if, large percentages like that are in need of instruction, that to me goes back to a tier 1 response. How do we support this universally? Because there's no way you're going to intervention your way out of 40% of students needing some assistance. So I feel for you all, but I love the idea of kind of looking at other data sources to better understand the needs of students.
That was the first thing that we decided as a district. This can't be a tier 2 or tier 3. We're not going to solve this via individual student interventions. It really needs to be a tier 1 approach. So yeah, we're on board.
Jonathan.
Just to piggyback on that, I think, you can't separate broader societal attitudinal changes brought about by the pandemic with this as well. I know in my own agency, our own work environment has changed. We are decidedly a little less formal than we were. We have more flexibility on hours and routines. It's just the way expectations have changed in the workplace based on our experience through the pandemic. And those things absolutely carry over into society as a whole. And so while obviously declines in attendance are concerning, we need to think about how everyone's attitude about doing everything that they were required to do prior to the pandemic have changed, and how do we provide a product and an educational experience that is enticing, that is relevant, that is engaging, that really compels kids to come versus requiring them to come. And I think this isn't necessarily the place to do it, but that is going to be or should be part of our thinking about how we approach this topic long term.
Thank you. Thank you, Jonathan. Appreciate those sentiments as well. Yeah, it's the reimagining, the moment to reimagine is now. I know Hetty and Sally mentioned about the free or reduced price meal breakout group. I shared that in the slide deck as well about free meal eligible, but it's the same data that's here. And I'll highlight these rows here. And I'll blow them up a little bit. Yep.
I think it may not be captured by the free and reduced price meals.
Oh,
There's a group of folks who are not free and reduced price lunch, and they're not affluent. They're not making 100K. And that's where I'm wondering if there are some challenges. I mean, there's a real mix in socioeconomic status here.
right. Free reduced price meal in Connecticut goes up to 185% of poverty level. But that still gets you around 50-ish K. There's a gap between that and the 100K that you're referencing. We just don't have that data. The closest we would have is the N group that's not eligible. So it is kind of a binary measure in that sense. You're either free or reduced price. We do have the breakout between free and reduced. And I think I just wanted to highlight this. You know, this column here is 1920. This is 2021, and this is 21-22. And generally what you see is that there was a drop off from, to look at the free lunch group here, going from 93 to 88 and then staying at 88 in 21-22, meaning that they're not the ones who have declined from last year. They declined from the year before, pre-pandemic, yes, but they're kind of holding this year. The ones who have declined really, the greater decline is in this group, going from 95%, 96%, almost 96% again last year to 93, 94%. I mean, that's 2%, so it seems like it's not much, but that's really when the whole distribution shifts this way. A whole bunch of kids now are becoming chronically absent by going below that 90% cutoff. So that's what's happening. That's why you're seeing the reduction is actually in those not eligible for free reduced price meals or non-high needs students, et cetera. I mean, that's what you're seeing. And perhaps those are students who were, some of them, and the chronic absence chart shows that those who were chronically absent last year are the ones struggling this year too. So they probably there was a subset of kids who were absent last year. They're the ones struggling this year as well. So and again, this data is available at the district level. It's in that same tab. So, you know, we're a large group. We're not going to be able to get into every nook and cranny of this data. There's just a lot of data here. But know that this is available every month. These don't represent that month's data. They represent year to date as of that month. That's an important point to remember. It's not monthly data as in just that month's data. It's up until that month. So it's cumulative. Yeah, so Rachel points to a really good point around the issue with the data here is that we have seen slight reductions in the percent identified as free reduced price meals because of the lack of incentive for folks to fill out the form, because there's no need for them to fill out the form because everyone's getting free meals because of the seamless summer program or other programs. So there's no incentive to fill out the form. Direct certification is still working and people are reporting that, but if you're getting free meals, there's no incentive to fill out the form. That's a good point. That has been, and I know, I don't think my colleague Shannon Yearwood from our nutrition office is on here, but I know they have messaged and continue to message the importance of filling out the form, but it is challenging on your end. We understand that. Other thoughts, comments on the data itself, or other observations about your own school or district? I'll switch back to the protocol. Okay, Just moving on, just to sort of expose you to different questions that you might want to think about is the next step in the protocol gets into high needs crosstab. Again, there's a lot of data here, but just to point out this high needs crosstab in this data, and it's this tab here, by high needs crosstab. I'm going to expand this up. There is a lot of disaggregation here that you can look at if you haven't already. And I will filter for just the state, just for illustration purposes. You know, we show you this breakout in many different ways. So you have different high needs flags. You have the FRL flag, the FRL type, whether it's free, reduced, not eligible, the EL or special ed. One means the student is EL, or the student is special ed, or the student is free, reduced, free meal eligible. 0 means they're not. So the first row here would be a student who is not high needs. They're not FRL, they're not eligible for FRL, they're not EL, they're not special ed. Okay. Can you guys see that? Is the size okay of the data? Okay. That's 240,000 students, roughly half of our students, a little less than half of our students actually. We are a majority high needs state. Just I know folks asked that of me. So if you look at their attendance going from 96% to 96% during the pandemic, when we were going through all these models, they were 96. This year, they're 94%. There's actually a decline with that group. This group here is free meal eligible, F, but they're not EL, they're not special ed. There's about 112,000 students statewide, so more than well, about a fifth of our student population, 20%. Notice that they went from 93% pre-pandemic to 89% last year. So there was a drop, but this year they're also at 89%. So those who are free meal eligible, but not students with disabilities or special ed, last year to this year, there's not much of a decline there. This group is free meal eligible who are also Ls. Yes, they've declined pre-pandemic to the pandemic, but last year to this year, really not a decline. They're poor, free meal eligible and special ed, I'm sorry, and EL. I might have mixed them up here, I'm sorry. This is the EL group. Their attendance actually may be slightly better, 18,000, 19,000 students, and so on. And you get, now here's the group of students who are free meal eligible and dually identified, EL and special ed. So they're like from low-income families who are also EL and special ed, 6,700 students statewide. Again, their attendance last year to this year is similar. That they haven't declined last year to this year. They declined from pandemic, pre-pandemic to pandemic. So again, just trying to see, this data is available for your own district, so you can actually see which sort of true subgroup here actually has greater decline than others. And so you have that data available to you at this granular level. And then the last 4 rows pertain to reduced meal eligible students, you know, combinations of EL and special ed. In some cases, you may not have a row of data because you have too few students. Any thoughts, observations with this step? There's also data by grade. There's a by grade tab. Yeah, I'm trying to see that. Oh yeah, here, right up there. And that gives you, for your district, by grade, to see where are the declines happening this year. And this is, here's ninth grade. We saw this challenge with ninth grade last year. And it's actually gotten worse from last year to this year. Attendance is actually weaker this year. Any questions, observations? Your eyes blurry? Just know that we update this every month. Yeah, there's a lot you can do, Hetty, with these data. There's just a lot of data here.
I was going to just add that I spend a lot of time in this data pretty much every month and do create some of these charts, and would be happy to help any district that might need assistance with that. It's really helpful.
And just lastly, I'll mention, I think there's also chronic absence data, obviously, that you could look at. There's also by grade band and by grade band by EL and grade band by students with disabilities. So part of the question was also whether, how does EL play out by grade band? So there are tabs in here at the very end. And if you don't see it, you could scroll to the side, but there's a grade band by EL so that you could see within your within a district, elementary, EL and non-EL. So 1 means they're EL, 0 means they're not EL. And you could see attendance patterns for EL versus non-EL by grade band. Elementary, high school, middle school, 6-8 gives you, it's basically the students in that grade band within the district. So I think I'm going to pause with the protocol, and again, there's the chronic absence data as well, and the chronic, that sheet also has your attendance. It tells you some interesting things, and actually I should open that data.
Ajit, may I ask you a question? It's Jay again.
Again?
Again, can you believe it? Because I jumped the gun before. It's actually in this step, in step 5, with that data file, the chronic absence rates, et cetera, et cetera. When you open that up and go to the primary disability tab, that's where all the districts aren't represented. And I'm wondering if it's because of the end value.
Yes,
okay.
That's probably what's going on. Yes, Brianna is nodding.
Thank you.
Yeah, that's why, that's what's going on. Got it. So here, I just want to point out, there's some resources, some interesting information here as well. It obviously shows you the district, it shows you the students and the chronic absence rate. It also shows you that extreme chronic absence. And help me out, Brianna, this is 75%. What was the absence rate for that?
25%. That's why you see a lot of missing here, because we're going to suppress anything fewer than 5 students.
Yeah. And you said what percentage was it? 75?
25.
25%.
Attendance.
Oh, attendance. So they're missing 75% of their days. So it's extreme, super extreme. So it tells you how many, what is the percentage of students. So it's a small subgroup of students. But what I want to actually bring you to is these last, these additional columns here. This actually shows you some interesting things here, and I want to just take a moment to just show you. And this is available for each of your districts, right? So you have this data. So it's showing you how many students have at least one remote day. Statewide, it's at 145,000 out of a 495. And I had mentioned before that it was about 29 to 30%. That's where that comes from. And of the students who are remote, they are statewide on average attending they average have 5 remote days. So which is why I was saying, you know, when you look at how many days are in person, vast majority of days are in person. So among the students who are experiencing some remote, 145,000, on average, they've got 5 days, meaning that the rest of their days are all in person. And this tells you the in-person membership days, and here's where you get the 98% for the state, and their in-person attendance rate. Then it shows you their remote attendance rate as well. And if you remember, I talked about how the attendance on remote days was substantially lower. That's where that comes from. And you have that data for your district. So you can look at how your own remote program attendance actually is playing out. And then of course, there's the total attendance rate as well, but this gives you a comparison between your in-person and remote attendance days. Sean asked, where do I find this data? It is on the same web page, Sean, that it's in the protocol. It's linked here. But if you don't see it here for whatever reason, you can also go to the supporting student participation page. And Brianna is just uploading the Excels. So you can just get the Excels from there as well. But these Excels will be updated every month. So if you go to the web page, you'll get the most recent Excel. But for now, you've got the Excels right here as well.
I'll post the webpage.
Okay, no problem. And again, the web page, I will pull that up as well. Is this page. And the Excels are right at the bottom of these charts and the map, it's right there. The same 3 Excels that Brianna just put in, or 2, maybe she's looking for the 3rd one. But those Excels are right here. And the charts I showed you before, they're basically these charts. So our kids are pretty much, oh, Kara, go ahead.
Question at the state level, if folks are talking about the accessibility of healthcare to our high need students, particularly in urban areas, we've had a huge issue around students being able to see doctors in a timely way. You know, we try to follow all the protocols of like having kids medically cleared properly, but still having them enrolled in our district. We've seen like, as kids even still transfer in mid-year, because we have a lot of kids come in around January, these students are having a real challenge of having medical appointments, despite social workers being highly engaged and other things. So I'm just wondering if there's been some conversation kind of between departments at the state level. I mean, kids are missing a lot of school in a lot of the more urban areas, it seems, due to this issue. And especially too for unvaccinated kids who are considered symptomatic and needed a negative COVID test to return. Like, I just think we are working super hard at engaging with families, and we're talking to them, but the students are still having to stay out. You know what I mean? Like we're keeping that rate pretty high. So.
Kari, can you make a note, or at least, or if you have something to share, yeah, obviously jump in. But.
I do. I just wonder, has the district worked with the local health centers to set up?
Oh, for sure. We've done weekend clinics, all of that stuff for the physicals, like that's been worked on, but it's just honestly the everyday as well. The access issue, the access to testing earlier in the year, it's lightened up a bit. I see someone else put it in the chat.
Yeah, and we have a resource for that I'll share with you that talks about what schools can do and what communities can do. And the community partnerships are really important in this work for making access to, especially for families who are new to the country, and helping them get access to healthcare. It is a big issue. And and takes the city and the school district and the health departments to kind of help figure out a pathway for families. It's not
And I
easy
think
work.
the initial engagement, we've been working on that with the community, so I appreciate any other resources you can send, but it's
Mhm.
also the ongoing healthcare. Like the amount of appointments that are available in these clinics are not many. You know, even if we get the initial physical in, it's like when they're symptomatic and things like that and testing. So,
Mhm.
but thank you. Anything you can send would be great.
I'll send that to you, Kara.
Can I just add to what Kara said? Hi, I'm Ann Mead. I'm Director of Family School Partnerships here in Danbury Public Schools with Kara. We have partnered with our Richfield VNA Health, which is a community organization, and they come in once a month and run clinics. They
Mhm.
send doctor, nurses, vaccines and everything. So we had one Tuesday night. We were able to process through 10 children.
Yeah.
And then our middle school and high schoolers, we refer to our school based health clinics.
Mhm.
That has been a way that we've been able to expedite
Okay.
students into our schools.
Mhm. And they have the time and the slots for appointments generally. for
They
the older kids.
do, and they have their own funding. So
Mhm.
this is totally free to our families. So they really, really
That's
appreciate it.
excellent, Anne. That's a good point. I was going to bring up the school-based health centers, and that's kind of if you have them, that's fantastic, but not everyone has them. But I'll send you this resource and maybe you two can connect and
Yeah, great.
Thank you.
Thank you.
Nice to see you, Anne.
Thank you. Good to see you too, Carrie.
Any other thought, observation? As we wrap up here, I know I said I would address the remote learning commission question. And I know it's like buried in the chat way back. Could somebody just jump back and kind of say what the question is with remote learning, with the remote
That's
learning
you,
commission?
Nancy.
I worked with all of them all the time. That is great. Yeah. So this is like.
I can't hear that.
Yeah.
So Ajit, it's Sue Ferguson from Torrington. I put
Yes,
a
hi, Sue.
question. Hi, I put a question in the chat regarding that early on. We received just a very little bit of information about a week ago about the Remote Learning Commission and wondered because, and to be honest with you, it was handed to me, so I'm not sure what the primary source was. But the information we got said that there would be a requirement for districts to roll out a formal remote learning program for this coming school year. So we were
Okay.
just wondering when we could expect a little more information on how this was all going to work.
Okay. Okay, so that's an easy point. The remote learning statute that's there for next year allows districts to create a remote learning program offering in 9 through 12 only, grades 9 through 12 only. It is optional. No district is required to do anything around remote learning if your local board doesn't want to.
Okay.
But if there is a need, there is an interest, and you want to do something, then you can offer remote learning, but in grades 9 through 12 only. The department is coming out with standards for that remote learning. We've had drafts circulating to different stakeholder groups and so on. But it's optional. You're not required to do it. I think that's the first thing to clarify.
Yep.
The standards, as we all know now, doing remote learning well takes time, takes capacity, takes effort, takes planning. It's not something you just do slipshod, just stream into the classroom and all that. You need to do it right. So the standards are pretty challenging and exhaustive, rightly so. So we're asking districts to, when we put the standards out very soon, you'll be able to see it, you'll be able to look at it, figure out like, do we want to dabble in this next year? Do we want to wait? You know, at a minimum, what this could allow you is in 9 through 12 only, if, for example, this is an illustration, okay? If you have students who are doing, let's say, VHS courses now, you know, virtual high school, some of you may know that, and they're taught by teachers from around the country, not necessarily Connecticut teachers, right? They might be an online teacher, and you may currently have the student doing that class in a period in the high school, like maybe they take one period and they go do that. With this statute, you might have the flexibility, if your board wants to do it and your district wants to do it, to allow that student to access that course remotely without being in school and have that count as an attendance for that kid. You know, that might be the smallest way in which you could start. And that is now permissible because the kid can be remote when they learn. So watch for the guidance and then figure out how you wanna move forward.
Okay,
And
thank you
Kari-
thank you
no
very
problem.
much.
Kari, go ahead.
Yeah, hi. I just wanted to invite Carly Roca Reyes from Bridgeport. We have her on deck to share how she uses protocol tool last year after this meeting. Carly, I'm sorry.
Oh my God, Carly, sorry about that. We totally ran out here. Didn't give you enough time.
Oh, you're muted, Carly.
Oops, sorry. Did you want me to share or there's not enough?
If you wanted to say a few words and maybe just invite people that they can contact you.
Sure, absolutely. And I'll just show you, this is what I do. I snip all of the reports and I put them into a document just so it's really easy during the district attendance meetings for everyone to see. And I keep it month by month as well, because sometimes small celebrations are really meaningful. And so if we can see a little bit of an increase or a decrease month by month, that gives us, some hope. And so we review snip by snip of each one with the link there, which is so nice that we use the same link every time. And then we create a monthly resource guide with some resources that goes out to all the school-based attendance teams, following the discussions that we have at the district level. And one last thing, I know I have no time, but we use these high level reports to then try to break it down and find some more patterns. Like, for example, when we look at high school, we noticed that 10th and 12th grade were an area we needed to focus. And so then we talk about what reports we can then use that look a little bit closer. So then we built a report that has the age of the student and the credits they've earned. Are our overage, undercredited students, are they experiencing higher chronic absenteeism rates? So, sometimes it seems like the reports are so high level, but then we can really identify through those reports what specific areas we want to investigate a little bit deeper.
Thank you so much, Carly.
Sure.
Really
Perfect.
Kari,
Awesome.
I'm going to suggest we're going to have Carly present on a national webinar. You can then make the presentation of Carly presenting with you available back to Connecticut.
Absolutely. We definitely will do that. All right. Thank you.
Yeah, thank you. Sorry about that. We didn't give you enough time, but that was perfect. I just wanted to say one other thing. I know there were some comments about accountability and chronic absence and all that. I mean, we are restarting accountability this year. I think everybody knows that. And it is normal to, at this point, given where the numbers are, to be like, oh my God, chronic absence is so much higher, et cetera. It is high for everyone across the board. We're all in this together. And just know that chronic absence is part of the accountability system, but the accountability system is not just a gotcha. It's not meant to be a gotcha. It's meant to be informational so that we can all look at it and act on it. When we just also know that when we identify schools for support, like turnaround and focus schools, we're using 3 years of data. We're not just using 1 year of data. So we're using 21, 22, but we'll also be using 2 of the prior years. So just know that there are, in chronic absence, the way we give points in our accountability system too, it's not all or nothing. It's all points on a sliding scale. So, just know that, and we know it's kind of like, oh my God, chronic absence is so much higher. What are we going to do from an accountability standpoint? At some level, these are the data. This is the reality that we're all facing, and we just have to collectively continue to problem solve and move forward. So we're in this with you and here to support you. So just wanted to make that point as well.